Good morning and welcome to our fourth webinar with Giovanni Maciocia. I see we have a nice international audience. Welcome everyone. The webinar is brought to you by Acuria Medical. My name is Monica, and Acuria Medical is established in the US as a new master distributor of the Tree Treasures products. And our goal is to provide you with better prices, better service, and faster shipping. We also would like to help with your professional development and organizing webinars with Giovanni on a regular basis. And as always, we are very grateful to him that he's willing to share his knowledge and his time with us. After the webinar, you will receive an email from me with a special offer for the Tree Treasures products. And now I hand it over to Giovanni. And again, thank you and welcome everyone.
Good morning, everybody. I love this technology. I guess you can see here the chat pod, so you can see where people are from. It's quite amazing. I think this new technology is fantastic. There are people in France, in Nova Scotia, in Canada, in Tenerife, 2 or 3 from France, Marseille, Mexico, of course, the United States, Germany, as you can see, Greece, Indonesia. And there is someone also in China, I've lost it now. Anyway, someone from Guangzhou in China. And of course, many from the United States and Spain and Israel. Sorry about it. Before we start, I want to show you this screenshot. There are only 2 things you need to know. First of all, the icon for the speaker should be green. Obviously, you should turn it on to have sound. And the second thing you should know, if you have questions, you can write them here in the pod that we're using, the chat pod. You can write them there. Just a moment. In the chat pod that we are using. And I'll answer the question if there is a break in the lecture and a suitable time. And I can only answer questions that require a relatively short answer. So you can't ask, how do you treat multiple sclerosis, for example? Okay. So let us start, and we will talk about both anxiety and insomnia, because the pathology of the two is very similar. The patterns, as you will see, are very similar, and the treatment is also similar, but there are differences, especially from the acupuncture perspective. There are some acupuncture treatments that are specific to insomnia rather than anxiety. Okay, so let's start by talking about anxiety, which, as you all know, is an extremely common problem in the patients we see. And by the way, one of the major good side effects of acupuncture that I've always noticed in my practice is that it is relaxing, as you must have noticed. Whatever they come from, whether it's B syndrome or diarrhea, constipation, pain in the shoulder, I would say 8 or 9 times out of 10, I find that you put the needles in and it's very relaxing. So we can treat anxiety very well, very successfully with both acupuncture and herbs, and it's much better than taking Western medications that have lots of side effects. So in Western medicine, anxiety, there are many different types of anxiety, which are listed here on this list. And I will concentrate primarily on the first one, which is called generalized anxiety disorder. But I also want to say something about panic disorders and what panic disorders mean from a Chinese perspective, because that's quite interesting. And in Western medicine too, they recognize these physical symptoms that are associated with anxiety, which from our perspective, from a Chinese perspective, the physical and the emotional mental symptoms are not differentiated. As we know, the pattern involves physical, mental, and emotional symptoms. So for us, this is completely a normal procedure to ask about the physical symptoms. And a big difference with Western medicine is that if you look at that list, it's just a random list of symptoms, which don't really mean much from a Western point of view. From a Chinese point of view, they mean a lot. Because often the differentiation, the diagnosis, depends quite a lot on the physical symptoms. In fact, when someone suffers from anxiety, I always ask them, where do they feel it? You may have anxiety and get headaches. You may have anxiety and you get the famous lump in the throat. Or you may have anxiety and you feel a feeling of oppression in the chest. Or you have anxiety and you get diarrhea. So, and all those symptoms, physical symptoms from our point of view, are very significant, very important. So that's a big difference with Western medicine. Notice here there is difficulty in swallowing, which would be what we call the famous plum stone syndrome in the throat. And there is a big difference in the view of the body from the Western point of view and the Chinese point of view. This is the Western view. The cortex influences the hypothalamus. The hypothalamus sends a message to the sympathetic and parasympathetic nervous system, which affects the organs. So it's like a pyramid starting from the cortex. We do not see the body that way. Like a pyramid with the Shen on top and the body below, we see it more like this. The Zhangfu and the Shen are like an integrated unit with Qi. It all depends on Qi. Qi can make you anxious and can also cause you diarrhea. It's the same Qi, the same pattern, the same disharmony. So that's a very big difference from the Western point of view. The other big difference, as I've already mentioned it, is that the physical symptoms aid us a lot in the diagnosis of the pattern. But this is a description of panic attacks. It's much more intense than anxiety. It has acute episodes that start without an apparent reason. And usually they usually last 10 or 15 minutes. And this is a list of symptoms. And I've highlighted there in yellow the symptoms which are significant from my point of view, and it will be clearer in a moment why they are significant. And notice what it says there in the yellow box. A sense of things being unreal, depersonalization, a fear of losing control or going crazy, and the fear of dying. We'll see in a moment why I've highlighted that and what it might mean from the Chinese perspective. So from the Chinese perspective, as I said earlier, the body and the mind, the Shen, the body and the Zhangfu are an integrated unit. And the physical symptoms that you get with anxiety or panic disorder depend on the Po. The Po, you've heard of the Hun and Po. The Hun I translate as ethereal soul, the Po as the physical soul. So Po is the physical soul. All the Qi processes that go on in the body are manifestations of the physical soul, the Po. And that's a typical Chinese concept. Actually, it's not that typical. The ancient Greeks had it too. Aristotle had it too. But it's certainly typical compared to Western medicine. So the Po is the physical soul. All the physical changes that go on are manifestations of the Po. And that's very significant. Why? Because they means that you treat the lungs, because the Po resides in the lungs. And that's, as you will see, that's a very important consideration in treatment. We'll see some diagrams also that show that. And this is especially with the panic attack. The physical manifestations are very strong. There's a feel of choking, of palpitations, the blood pressure rises. So the Po, and therefore the lungs, is even more involved in panic attacks. And that's why I believe that the treatment of the lungs is very important in anxiety. And that, by the way, is a big difference with the treatment of anxiety from Chinese books. That's only my view. I always treat the lungs, or nearly always treat the lungs in anxiety, and I've added 3 patterns to do with the lungs, which are not in Chinese books. So let's look at anxiety in Chinese medicine. There isn't a chapter in Chinese books called anxiety, but there are many Chinese diseases which correspond to anxiety. And that happens very frequently. You know, we are faced with a modern disease. You know, you have a patient with multiple sclerosis. What is it from the Chinese point of view? Or a patient with endometriosis, what is it? You don't get a chapter called endometriosis in the Neijing, although you do get it in modern books. So we're going to look at A, which Chinese diseases correspond to anxiety. We're going to look at B, the rebellious Qiu de Chongmei, what is palpitations, and the difference between Shen unsettled and Shen obstructed in anxiety. Okay? So let's start with A. Do you understand what I mean by Chinese disease? Chinese disease is called Bing, which means disease in Chinese. If you pick up a book, a traditional Chinese medicine book, there will be chapters, for example, in gynecology called painful periods, heavy periods, chest pain, etc. Those chapters, those are diseases from the Chinese perspective, and it's called Bing. And to identify the disease is called Bianbing. And the Chinese doctor will always do that. Before identifying the pattern, will identify the disease. So, for example, in gynecology, painful periods is a Bing, a disease. And it's not a disease in Western medicine. In Western medicine, painful periods is a symptom, it's not a disease. So on this slide here, I have a list of Chinese diseases, Bing, all of which correspond to anxiety. So there isn't one Chinese disease, but at least 4, and actually more than 4. These are the main ones. There is Jingji, Zhenchong, Fanzao, Zhangzao. When I lecture, I prefer to use the Chinese names rather than translating it. And those are my translations on the left. And sometimes, as you very well know, it's very difficult to translate Chinese terms. So I've come to the conclusion that it's better to stick to the Chinese terms. And Jingji is a very well-known Chinese disease, which literally means fear and palpitations. So let's look at them one by one. And these are the Chinese characters, if you're interested in Chinese characters. By the way, we should have sent everybody a handout. If you haven't received it, it's no problem. Just send Monica an email and you will receive a handout with all these slides. One thing to notice, I don't know if you can see it in these characters. On the left of these characters, those 3 squiggles on the left are the heart. So that immediately tells you that that character has something to do with the mind, the emotions. It could be memory, it could be insomnia, anxiety, etc. As you can see, all 4 of them have the heart on the left, because obviously if you have anxiety, the heart and the Shen are obviously always involved. So Jing means being alarmed, anxious. Ji literally means palpitations, but paradoxically, this disease is called Jingji, fear and palpitations, but paradoxically, you don't have to have palpitations to have this, okay? Zheng means terrified, panic-stricken, and Chung also means anxious and also means palpitations. So these are the 2 main diseases, Jingji, the first 2, and Zhenchong, the second 2. And this is the differentiation between the two. First of all, fear and palpitations is milder than Genchung. Genchung is stronger. And fear and palpitations, you can see here, is usually caused by external events like fright or shock, and usually is of a full nature. Genchung is not caused by external event. It's usually a mixture of a deficiency and a fullness, and it is more serious than Jingji, and often it manifests with a sensation in the chest or the abdomen. It could be tightness, a tension, a feeling of weight, something in the abdomen and chest. And that's one example where the inquiring about physical symptoms is so important for us from the Chinese perspective. If someone says they feel anxious, or someone else says they feel anxious and they have a feeling of a knot in the abdomen and the heaviness of the chest, that's very significant for us, because that means that have Genchung rather than Jingji. And this photograph here illustrates that, that principle. In Genchung, there is a we call panic throbbing sensation from the abdomen to the chest. And these are the description of Jingji and Genchung from these two famous Dr. Zhu Danxi and Zhang Jingyue. I'm not going to read it because you have your handout. Notice an interesting thing, what Zhang Jingyue say in the blue box. In panic throbbing, the heart is shaking in the chest and the patient feels fear and anxiety. So it's a description of Genchung. And notice what he says, there is a yin deficiency and exhaustion, so that the Zhongqi is the qi of the chest, has no root. This is very interesting quotation, very interesting statement. So there is a disconnection between the lower part of the body and the Zhongqi of the chest that has no root, and it gives you that feeling in the chest. Notice what he says, the Zhongqi has no root and qi cannot return to its origin being in the abdomen, the lower burner. For this reason, there is shaking or throbbing of the chest above and throbbing on the sides of the umbilicus. Okay, so that was Jingji and Genchung. Next, Zhang Zhao is another disease, which is basically anxiety. And Zhang Zhao is very ancient. It's in the Jingui Yalue by Zhang Zhongjing. There are 2 or 3 diseases that are in the Jingui Yalue in the gynecology chapter. That does not mean that only women have it. Okay, so that's very important to clarify. So men have this too. Zhang Zhao is impossible to translate. That's why I've come to the conclusion that it's better not to translate, because Zhang means Zhang, the yin organ. And Zhao means agitation, so visceral agitation, agitation of the yin organs. As I said, if you have any questions, write them in the chat pod as you've been writing where you come from. And this is a description of Zhang Zhao in the Jingui Yalue. The patient suffers from Zhang Zhao, feels sad and tends to weep as if she were haunted. I put she there because it's a gynecology chapter, but I repeat, men get this too. She stretches frequently and yawns repeatedly. The decoction is Fu Xiaomei, Zhegan Zhao, and Da Zhao. And this is a very famous decoction, Gan Mei Da Zhao Dang. We'll come back to this when we talk about patterns. But it is a decoction, is a prescription which I call one of those miraculous prescriptions. Why do I call it miraculous? Because it's only made of 3 herbs, which are more like foods than herbs. Fu Xiaomei is wheat husk, the husk of the wheat. Zhegan Zhao is licorice, And that's how it's black dates. So it's just black dates, licorice, and wheat husk. It's almost like foods. And none of those three ingredients has any profound mental emotional effect, but together they do. It's an amazing formula which I use a lot. We'll come back to this. We'll see the pattern associated with this formula. Notice something there. The patient suffers from agitation, feels sad, and tends to weep constantly. So I would say this is a patient who has anxiety and depression. Because, by the way, anxiety and depression together is also very common mental emotional pattern, mental emotional disease. And I would say this is a description of a patient who is depressed and anxious. And notice yawning repeatedly. That would be kind of a lung symptom. And that's why I treat the lungs very frequently in anxiety. So that's Sang Tao. And this is a description of Zheng Chung and Jingji from a modern Chinese book, which also has other Chinese diseases which we're not going to discuss because they all boil down to anxiety. So what I would like to discuss, and number B, is the rebellious Qiu de Chungmei, because the rebellious Qiu de Chungmei also is a type of anxiety. And briefly, what does it mean, rebellious Qiu de Chungmei? The Qi of the Chungmei, as you know, the Chungmei starts from between the uterus and goes to Ren 1, and then stomach 30, and then goes up the abdomen on the kidney channel, and it spreads over the breasts and goes through the throat. So the Qi of the Chungmei frequently rebels upwards. It goes up too much or too forcefully, and that's called rebellious Qi. And that rebellious Qi causes what you can see here in this slide, internal urgency, Li Ji. These two terms are very ancient. They're actually already in the Nanjing, as you can see here, chapter 29. There is rebellious Qi of the Chungmei causing Li Ji. Li Ji is called, literally means internal urgency, but all modern Chinese doctors agree that it's basically anxiety. So some patients who come to us with anxiety, especially women, could be due to this, to the rebellious Qi of the Chungmei. But how do we know is the rebellious Qi of the Chungmei? We know it because of these symptoms. In order to diagnose rebellious Qi of the Chungmei, is not enough just to be anxious. You have to have some of the physical symptoms illustrated in this slide. As you can see, they're all in the abdomen, over the stomach, the breasts, the throat. But you don't have to have all those symptoms. 3 or 4 symptoms at different levels. Let's say you have anxiety, as you have in this slide in red, and headaches all the time, okay? That's not enough to say, oh, you've got rebellious Qi of the Chungmei. No, you must have 3 symptoms at least at different levels. For example, fullness, distension, and pain, or the lower abdomen, maybe distension of the breasts in women, and the feeling of lump in the throat. You have these 3 symptoms at 3 different levels with anxiety, especially in women. That's why I have a picture of a woman here. That is rebellious Qi of the Chungmei. And you treat the Chungmei. And in addition to these symptoms, there is also, if we go back to the previous diagram, there is also cold feet and hot face. There is a hot face because the Qi rebels upward, and there is cold feet because of the Chungmei descending branch. The Chungmei from stomach 30 has a branch going down the medial side of the leg, so the Qi is going up too much and not enough to the legs, so you have this contradiction of cold feet and hot face. And if you don't know about this pattern of rebellious Chiu-Mei, you're confused. Why does she have hot face and cold feet? That is not, that hot phase is not full heat or empty heat. It's just a Chiu-Mei disharmony. Okay, so that's important to remember. And this happens quite a lot in men get it too, not only women, but it's more common in women. And I've seen this rebellious Chiu-Mei at all ages. I've seen it in a 13-year-old girl or women in their late 60s. And the rebellious Chiu-Mei, by the way, is also a factor that aggravates the menopause. It's not the cause of the menopause, but it's something that would aggravate the menopausal symptoms. So here on the left of this slide, you have a schematic representation of the Chiu-Mei. From REN1 goes up, it actually starts from the uterus, goes to REN1 and then up the abdomen on the kidney channel, chest and breast and face. And it has a descending branch going to the legs. So if you have especially if you have a woman patient, I repeat, men do get this pattern too. But especially if you have a woman patient, she has anxiety, hot face, cold feet, and 3 or 4 of those symptoms, it is rebellious Chiu-Mei, and we're going to have slides with the treatment later on. And these are the characters for Li-Ji, the famous Li-Ji, internal urgency. Look at the second character, G, also as the heart. This is the heart. At the bottom is the heart. And that's a hand grabbing. So it's like you feel like a hand grabbing the heart. And that's the meaning of G. Urgent, anxious, impatient, rapid, fast, irritated, annoyed, etc. So as I said, this slide repeats what I just said earlier. It is necessary to have at least 3-4 symptoms at different levels. If all the symptoms are in the lower abdomen, it's not rebellious Chiu-Mei. Or if they're all in the head, it's not rebellious Chiu-Mei. And the Chi of the Chiu-Mei usually rebels upwards from emotional problems, often associated with the deficiency of the kidneys. So there is a deficiency of the kidneys below. As that doctor said, the Chi has no root, is not rooted, so it goes up and rebels upwards. So my view is that the Chi rebels upwards for 2 reasons. 1, the deficiency below of the kidneys, and 2, emotional stress. Both things which are incredibly common in the patients we see. 3, I wanted to say something about palpitations. It's very important. All the Chinese books always have this symptom of palpitations. And I want to clarify what they are. They are purely a subjective symptom. What does it mean? Normally, if I'm sitting here lecturing, I'm not thinking of my heart. I'm not aware of my heart beating. I don't have palpitations. I would define palpitations as an uncomfortable awareness of your heart beating. That's all. Uncomfortable awareness of your heart beating. That, in my opinion, is palpitations. It's purely subjective and is not to do with the speed of the heart. It could be slow, it could be rapid. And it's not to do with the rhythm of the heart. It could be irregular. I'm saying this because if you ask one of our patients, do you get palpitations? They think you mean tachycardia, i.e. the heart going fast. And we do not mean that. You could have tachycardia and not have palpitations. Your heartbeat could be irregular if you have some heart disease, some valve disease, but not have palpitations. Vice versa, you can have palpitations and not have any irregularity of the heart, speed or rhythm. So it's purely a subjective sensation, which I would describe as an uncomfortable sensation of your heart beating. And it can be extremely uncomfortable. It can be very mild, or extremely uncomfortable, you feel your heart is beating fast, and it's not. And some people say it's like the heart is in my throat. That's also palpitations. So, why am I saying this? I do not ask a patient, do you get palpitations? I would ask them, are you sometimes aware of your heart beating in an uncomfortable way? And if we ask like that, you'll see that a lot of people do have palpitations. But if they think you mean tachycardia, and you ask them, do you have palpitations? They say, oh, no, I don't. Okay? So I just wanted to clarify that. What is this symptoms that we call palpitations? It's purely subjective. And lastly, I wanted to say something about the difference between Shen unsettled and Shen obstructed. And this is purely my own classification of Shen disturbances. I don't want to spend too much time on this, but I only want to say something about this in relation to panic attacks. So I distinguish three Shen pathology. The Shen can be weakened. What does it mean? You have blood deficiency, heart blood is deficient, the Shen is weak because of the heart blood deficiency, and on a physical level you feel tired, and on a mental level you feel depressed. And I call that Shen weakened or deficient. Or the Shen can be unsettled, and anxiety is a classic manifestation of the Shen being unsettled, agitated. So you can be depressed without being agitated. And in anxiety, obviously, is a very obvious case of the Shen being unsettled. But there is a third pathology, which I call the Shen obstructed, or sometimes they say the Shen is misted, like mist. And what happens in Shen obstructed? There is a certain loss of the sense of self and a loss of insight. The best way to understand Shen obstructed is basically mental illness. Serious mental illness like schizophrenia or bipolar disease. If you ever seen a patient in the manic stage of bipolar disease, the Shen is obstructed. There's a loss of insight. In schizophrenia is a classic example of the Shen being obstructed. A person might think they're Jesus Christ, for example. So there's a loss of insight, which you do not have with the Shen unsettled. You may be anxious, agitated, but the Shen is not obstructed. But the point I want to make in relation to the Shen obstructed is that I've given you an example of the Shen obstructed, which is easy to understand in the serious mental illness, but you don't have to have mental illness to have the Shen obstructed. The Shen can be obstructed in different degrees. It can be very mildly obstructed, and there is a certain mental confusion, a slight loss of insight, which is not mental illness, and many people do have Shen obstructed. So what difference does it make? In my opinion, panic attacks are an example of a mild obstruction of the Shen. And the Shen is also unsettled. So in the treatment, we have to calm the Shen because it's unsettled, very often using sinking substances, which will explain what they are. But we need also to de-obstruct the Shen, and we'll see what that means in a moment in the other slides. Yes, this slide here clarifies what I just said. Shen weakened, Shen unsettled, and Shen obstructed. And this can be combined, of course. In panic attacks, the Shen is unsettled and obstructed together. What difference does it make? It makes a big difference to the herbal treatment. And here you have the herbal treatment. If the Shen is weakened, you need a sweet taste, like Gammei Tatsao, which is very sweet. If the Shen is unsettled, depends what is unsettling it. The Shen can be unsettled by a full heat. heart fire or liver fire, can make you anxious, or empty heat from yin deficiency. So the treatment depends on that. But when the Shen is obstructed, you need to deobstruct it with the pungent taste, as you can see there. And personally, when I make a Chinese prescription, I always think of the taste, of the overall taste of the prescription. So if the person has panic attacks and the Shen is obstructed, the prescription must have some pungent herbs to deobstruct the Shen. And you can look at these slides later on in your handout. It is a more, in the Shen unsettled, which is anxiety, there is actually 3 possible conditions. You can get it purely from blood or yin deficiency, or yin deficiency with empty heat, or full heat and full fire. And heat and fire are actually different, and we're going to look at the differences between those two. And of course, full heat is very different than empty heat from yin shu. So it's very important. This threefold distinction is very important in the choice of herbal treatment for anxiety, i.e. Shen unsettled. Okay, the etiology of anxiety obviously is emotional stress. One important thing I wanted to say about emotional stress as a cause of anxiety: just because the patient is anxious, and anxious means fear, basically fearfulness, in my opinion, any emotion can lead to anxiety. So it doesn't have to be fear. If we consider the 5 emotions related to the 5 elements, or the 7 emotions, which, by the way, are very restrictive lists. The emotions are many more than 7, the 7 emotions of Chinese medicine, but that's a separate issue. There are many emotions that are missing in Chinese medicine, such as shame and guilt, which we have here. Nevertheless, any emotions can lead to anxiety, even the so-called excess joy. And as you can see here, and especially worry, I put that worry the first on the left, because anxiety is not characterized by fear only, but also worry. Worrying about the future, worrying about money, worrying about your children, always fearing the worst. Your child doesn't come home yet, and you're worried that they had an accident. So any emotion can lead to anxiety, not just fear. And that's very important for the treatment. By the way, very briefly, excess joy, I've come to the conclusion that excess joy is not a good translation of that emotion, and I would call it overstimulation, but we don't have time to discuss that now. So my note there in yellow is: do not equate anxiety with fear only. Any emotions can lead to it. And we have to know that for the treatment. And this diagram here is a representation of the effect of emotions. And most of these patterns can lead to anxiety: chi stagnation, heat, fire, yin deficiency, empty heat, very much so, blood stasis as well, blood deficiency. Most of these boxes here, these patterns, can lead to anxiety. And phlegm, by the way, I forgot to say when I talked about obstruction of the Shen can only be obstructed by 2 things: phlegm and blood stasis, and especially phlegm. Very occasionally, very severe chi stagnation can also cause obstruction of the Shen. Constitution is very important. Sometimes I used to see 2 generations of a family, sometimes 3 generations. I used to treat a teenager, their parents, and his grandparents. And very frequently I saw that anxiety was something that runs in the family and is transmitted. The parents are anxious, the child grows up in that environment, and the child gets anxiety. So I noticed that very frequently. And the tongue often indicates that. It indicates that when it has a hard crack. And this picture here is an example of a tongue with a hard crack. The hard crack is kind of long. It takes nearly the whole tongue. It doesn't go all the way to the tip. And it's in the middle of the tongue. And what does it mean? The meaning depends on how deep it is. If the crack is very shallow, less deep than this one, it simply means that that person has a constitutional tendency to mental emotional problems, anxiety, for example. But it's just a tendency, and which means that if they do get anxiety or depression and they have a hard crack, it will be more difficult to treat than a person without a hard crack. And the deeper it is, the more severe it is. That constitutional tendency is more severe. And I find this absolutely reliable. The hard crack like that, when it's deep, they have mental emotional problems, and it's a constitutional tendency to it. And the deeper it is, the more severe they are and the longer they've had it. And this is a picture of the same patient. As I said, the hard crack is long. It starts from the back of the tongue, but it doesn't have to go to the very tip. So this is a typical hard crack. Irregular diet, I don't need to spend too much time on this. We're all very familiar with it. Irregular eating or eating foods that lead to dampness or phlegm. Loss of blood, not that common, but if a woman has a heavy loss of blood with childbirth, for example, she may have postnatal depression and or anxiety from the loss of blood, not nourishing the liver and the heart, and therefore affecting the shin. Overwork is a very common cause of disease in the patients we see. And by overwork, I don't mean physical work, but working long hours without rest, leaving home at 7 in the morning, coming back at 8, just working very long hours for year after year after year. In my experience, that's an extremely common cause of kidney deficiency, and especially yin deficiency. And yin deficiency easily leads to anxiety. So let's look at the pathology and the treatment principles from the Chinese perspective. First of all, these are the 3 Zangfu that are usually mentioned. No, these are the 3 Zangfu that I believe are mostly involved in anxiety. And as I said, the lungs are not usually mentioned in Chinese books. They always mention liver, heart, and kidneys. But in my opinion, the lungs are very much involved for a couple of reasons. One, because anxiety is not just fear, but it's a very strong component of anxiety is worrying, which I said the emotion of the lungs. And secondly, because the lungs is housed in the Po, and the Po is affected by all the physical changes of anxiety. So that's why, as we can see, as we will see, I've added 3 patterns, 3 lung patterns for anxiety, which are not in Chinese books. And these are the treatment principles according to various doctors. As you can see, Judan Shi recommended resolving phlegm. But a very interesting statement is the one in the blue box by Zhang Jingyue. Very interesting from my point of view, because I have another idea about anxiety and the movement of qi that is different than the traditional view. I'll tell you in a moment. And look what he says here in the sentence in red. Yang is connected to yin and the heart to the kidneys. In this disease, Jingji, he's talking about Jingji, fear and palpitations, the upper part of the body is restless because it cannot link with the lower part. Heart qi is deficient and cannot connect with Jing of the kidneys. And this is a very significant statement, because he's saying that in Jingji, in anxiety, there is a disconnection between the upper burner and the lower burner, and a disconnection between heart and kidneys. In order to understand this better, you have to visualize the 5 elements. Instead of a circle of the Shank cycle, visualize the 5 elements as a cross. Fire on top, water below, vertical axis of fire and water, a horizontal axis of wood and metal, with the earth in the center, in a cross, which, by the way, is the earliest mention of the 5 elements is like this, in a cross-like fashion. So if you imagine the 5 elements like this, there is a vertical axis between fire and water and heart and kidneys. If you think of the co-cycle, water overcomes fire, right? You must not think of the co-cycle. Think of the 5 elements in a cross-like arrangement. And heart and kidneys communicate with each other, nourish each other. Fire must go down to meet the water, and water must go up to meet fire. In anxiety, if you read this statement, there is a disconnection between heart and kidneys. So one treatment that we must always do in anxiety is to establish that connection between heart and kidneys, and we'll see how that is done with acupuncture. And there is another statement from the same doctor. This statement is about Jingji, fear and palpitations, and this statement is about Zheng Chung, panic throbbing. He says the heart is shaking in the chest. You see how Zheng Chung is more severe. It could be panic attacks. The heart is shaking, and the patient feels fear and anxiety. Notice what he says. He says the same thing he said earlier. There is yin deficiency and exhaustion. Yin deficiency below, so that the Zhong Qi has no root and cannot return to its origin. That's the same thing, a disconnection between upper burner and lower burner. And in this case, he's talking about the Zhong Qi, which is the qi not only of the heart, but also lungs and heart, which shows the involvement of the lungs. So these two things are very important. In any type of anxiety, the more severe it is, the more there is a disconnection between upper burner and lower burner, between heart and kidneys, also lungs and kidneys. And we have to re-establish that connection, which we can do very well with acupuncture. And this diagram here illustrates what we just said. The heart cannot descend to the kidneys, fire does not go down to water, water does not go up. And the yuan qi of the kidneys cannot root qi downwards. Yang and yin cannot communicate. This applies to any type of anxiety, no matter what the pattern is. Heart fire, heart heat, liver qi stagnation, kidney yin deficiency, and any type of anxiety. There is that disconnection. And these are examples of sinking substances which we use, which would help to re-establish this connection, because these are sinking substances which make qi go down. And many of the sinking substances, I call them substances rather than herbs, because they are not herbs. Many of them are minerals. There is lungu, which is so-called dragon bones, or lungche, dragon's teeth. And the other one is Zhenju Mu. or there's mouli, also oyster shell. So many of the sinking substances to make heart qi go down are minerals like these. And they must be used in anxiety, at least one or two of those. Okay, here I've got the examples of tongues indicating Shen disturbances. And these 6 tongues are more or less in order of severity, starting from the top left, moving to the right, then bottom left, moving to the right. The first one will be the mildest. The color is more or less normal, except the tip is red. Red tip, by the way, with red points always indicates the Shen is affected by some emotion. Always. I've never seen that sign being wrong. But in this example, in this picture, it's mild. It's relatively mild. The second tongue, middle, upper middle, the tip is redder and is a little bit swollen. So the mental emotional problems are deeper and more long-lasting. The third tongue is completely red and has a red tip. So it's more severe. Why? Because the whole tongue is red. So there is more heat. And by the way, as we've seen in that diagram, of the patterns deriving from emotional problems always lead to heat, which is interesting, in the red tip or red tongue. There is no such thing as emotional problems leading to cold, which is interesting. And that's because emotional problems lead to qi stagnation first, and qi stagnation with time leads to heat. Just a moment, I'm going to look at some of this, see if there is any question here. Well, someone is saying that they find very difficult treating panic attacks. Well, hopefully this webinar should help. Can adrenal fatigue be considered a deficiency of the kidneys? Yes. Yes. Can an upward fluttering sensation coming from underneath the sternum be part of the rebellious Chung Mei pattern? Very much so. I would say that would be a very significant symptom. It's interesting that you use the word fluttering, because I interpret when a patient describes these symptoms in a kind of a strange, unusual way that is not in Chinese books, to do with the abdomen and chest. Not always, but frequently, that is a Chung Mei type of symptom. Some English patients say they have butterflies in the stomach, for example. No Chinese book will have these symptoms of butterflies in the stomach. But when I hear those strange descriptions, I always check that there might be rebellious qi of the Chung Mei. So what you say here, can an upward fluttering sensation coming from underneath the sternum be part of the rebellious Chung Mei pattern? I would say very much so. Can acid reflux be a part of the rebellious qi pattern? Yes, it can be. It can be. You said that the heart crack is not all the way to the tip. What does it show if the crack is all the way to the tip? The same. It is a heart crack, but it's only a heart crack if it takes the whole tongue, if it starts from the back. There are some questions here that I cannot answer because it would take too long, so do not be disappointed. Can the crack disappear or change greatly after long-term treatment? Yes. Those cracks that you can see in these pictures they will not disappear, but they will become less deep. And I've seen that happen all the time, and it doesn't take that long. Is lack of deep sleep mental agitation a symptom of unsettled Shen? Yes, very much so. A patient told me that around 12 a.m. he feels something go up from the sternum to the chin. Is this also true? It could be, yes. If someone told me that symptoms, I would suspect rebellious Child-Chungmei, but remember what I said. To diagnose rebellious Child-Chungmei, you must have some symptoms at different levels. Okay? How do you differentiate between a heart and stomach crack? The stomach crack is only in the middle of the tongue. There is an arrow function here, but unfortunately it's a bug because the arrow, I cannot move the arrow to show you things. So the heart crack, if you look at the tongue, the bottom right tongue is a very good example of heart crack. It starts all the way back, it goes nearly to the tip. It's a classic heart crack. The stomach crack will be only in the middle of the tongue, the middle burner section of the tongue. So let's continue. We were talking about the tongue on the top right, tongue bottom left. Why is that worse? First of all, the tip is redder. The tip has red points, so there's a lot of heart heat or possibly heart fire. It's been there a long time and it's very severe. On top of that, the tongue has no coating, and that's worse because it means there is yin deficiency, and yin deficiency is always worse. The bottom one in the middle, similar, has no coating. That yellow coating in the middle is without root. I don't have time to explain what that is. And the bottom right is the worst of all. Why is it worse? Because there is phlegm. Because I would say that because there is phlegm, the Shen, besides being unsettled, is obstructed. There is phlegm because the tongue is swollen, but most of all because of the sticky yellow dry coating inside the crack. And that's a classic situation of phlegm heat obstructing the Shen. When there is a sticky yellow coating inside a heart crack. So of those 6 tongues, that is the worst. Okay? And these are 3 examples of heart cracks. We've already seen them. Other types of tongues in anxiety. This one we've just seen it. Sometimes I see anxiety, also depression, but especially anxiety with the Shen unsettled and obstructed, with a very swollen tongue, like this. Notice when the tongue is very swollen, it kind of changes shape. Besides being long, it's kind of more round. So that means there's a phlegm obstructing the Shen. And seldom you see a tongue like the bottom one, with that strange shape like that at the end. And I've seen the tongue only when the Shen is seriously obstructed. Okay, this diagram is very important. Why is it important? Because it makes the point that all emotions affect the heart. All of them. Not exactly, because if we only look at the emotions from a 5-element point of view, the heart is affected by excess joy. And obviously it's affected by all other emotions. Worry, pensiveness, sadness, grief, fear, as you can see there. And that's a very small list. There are many more emotions. Why do they all affect the heart? Because the heart houses the Shen, and the Shen is the mind. When you say, I feel angry, I feel sad, I feel grief, I am worried, who is that I feel this, I feel that, is the Shen of the heart. And only the heart has the Shen. The lungs, the kidneys, the spleen, and the liver don't have the Shen, which is in the mind. And that's why all the emotions affect the heart, and that's why you must always treat the heart. And you can't treat anxiety without treating the heart, whatever the pattern. Whatever the pattern. But notice that there are dotted lines from each emotion to a tongue. So anger affects the liver, but also the heart. 7 affects the lungs, but also the heart, etc., etc. So you can always treat the heart, and you can always treat especially heart 7. And there's another diagram showing how all the emotions also affect the Po. Why do they affect the Po? Because they affect the body. We, in Chinese medicine, as you very well know, we don't make a distinction between the mind and the body. It's a one unit, a circle, as we saw earlier. And all emotions affect the body, and therefore the Po, and therefore the lungs. And that's why I also treat the lungs in anxiety, and especially lung 7. And so the points, those are the example of points that I would use for each of the Tsang Fu. Notice kidney 9, I have for the kidneys, is a great point. I use that a lot in anxiety, more than 3 or 7 or 6, because it's the beginning point also of the Yin Wei Mei, and it's a great mental emotional effect. And kidney 9 also reestablishes the communication between heart and kidneys. That vertical axis is called Ju Bin. Ju means host and Bin is guest, host, guest. The host is the kidneys and Bin is the heart. So the kidneys receives the heart chi. So it reestablishes the communication between heart and kidneys. It's a great point, kidney 9. So in every type of anxiety, whatever the pattern, you could use lung 7 and heart 7. And I do use them. And I wanted to mention another point, which is stomach 40, because I feel it's a misunderstood point. Everyone says it resolves phlegm. I wish it was that easy to resolve phlegm with stomach 40. Yes, stomach 40 does resolve phlegm, but on its own, it wouldn't have a lot of effect on phlegm. I think you can only resolve phlegm using many points from the 3 burners. I don't have time to explain how I resolve phlegm, but resolving phlegm with acupuncture is a very coordinated approach using several points from the 3 burners, upper, middle, and lower, plus stomach 40. So stomach 40 does resolve phlegm. But first of all, on its own, it wouldn't have very much effect on phlegm. And secondly, stomach 40 does many other things, which are illustrated in this slide, and it's very good for anxiety. Notice all the things that it does. It subdues rebellious chi, treats all full conditions on the stomach. Stomach 40 works on the chest. If you have an anxious person, they feel the anxiety in the chest, stomach 40 is a major point, together with either lung 7 or pericardium 6 or both. Is a great combination. Lung 7 and pericardium 6 with stomach 40 will affect the chest, relax the chest, and calm the mind. And as you can see, number 4, stomach 40 calms the Shen and regulates the heart. So I just wanted to make this point. It's a major point for anxiety, and don't think of it only to resolve phlegm. Can red spots on the sides of the tongue be related to Shen pathologies? Yes, of course. Red spots on the sides of the tongue indicate liver heat. Yes, very much so. Anger, repressed anger, frustration, resentment affecting the liver, causing liver stagnation leading to liver heat. Yeah, very much so. And very often, we've seen tongues with a red tip. Very often there is red sides and red tip. Both wood and fire are involved, the liver and heart. It's very common. In the fact the liver is the mother of the heart. Liver heat is transmitted to the heart, so it's very common. As someone says, never fully discuss how to express phlegm. I can't do that as well. You will find many of the answers of your questions, actually, you will find them on my blog. There is something on my blog on phlegm, and the last slide we'll see today will give you the address of my various websites. So you will find the answer to many of your questions in the blog. And I do know that there is something about how you resolve phlegm. Okay. Do for 224, I personally use it a lot. Here, especially in the United States, people use yin tang a lot between the eyebrows. I have nothing against yin tang. It's a great point. It's very good for insomnia, yin tang, by the way. But for anxiety, I think Do 24 has a much broader action, much deeper action. It's called Shen Ting, the courtyard of the Shen. It treats both anxiety and depression. It treats memory. It treats also people who have a tendency to thoughts of death. Not necessarily suicidal, but kind of morbid thoughts of death. And it treats memory, and it treats the heart as well. So it has a much broader action than yin tang, a much deeper action for mental emotional problems like, as you can see here, depression and anxiety, and also more severe conditions like bipolar disease. And it makes qi descend, as you can see here, and it makes a great combination in anxiety. Do 24 with gallbladder 13 here on the forehead, inside the hairline. Do 24 and gallbladder 13 together is a great combination. Very calming, which I often do together with Ren 15. And if there is a kidney deficiency, Ren 4. So I repeat, Do 24 and gallbladder 13 with Ren 15 and Ren 4. Is a great combination if they're anxious with a kidney deficiency, and also to re-establish the communication between heart and kidneys. It's a great combination. You mentioned treating families with Shen disturbances. Is it harder to treat when there is an established pattern in the family? Yes, definitely. How would the approach differ? The approach doesn't differ, but it will take longer and it will be more difficult to treat. This is a discussion of Do 24. I'm not going to discuss it now. You can read about it in your handout. It's called the Ting, the courtyard of the spirit of the Shen. And in ancient Chinese houses, the courtyard, which is called Ting, was a very important part of the house because social status was very important. So the courtyard, the entrance, gave the first impression of your social status and your wealth. So in the next two diagrams, I have the various areas of the body that could be affected with anxiety. As I said, I always, when the person complains of anxiety, I always ask, where do you feel it? As I said earlier, you can be anxious and get headaches all the time. You can be anxious and have the famous feeling of a lump in the throat, chest, distension, tightness, shortness of breath, palpitation, or you can get stomachache, or you can get diarrhea, constipation, etc., etc. And here in the next slide, I have some of the points for each of those areas. For the chest, here notice that I've got lung 7, pericardium 6, and red 17, which goes very well with stomach 40. Okay, so I'm not going to discuss these. You can look at in your handout. So that's very important to us, to relate the anxiety to the part of the body affected, because that is a pointer to diagnosis. If they have a chest symptom, it's, to me, that indicates that not only the heart is affected, but the lungs is affected very much, and therefore needs to be treated. If it's down here in the abdomen, then the liver is involved, liver and spleen, etc., etc. So it's very important to us to associate the anxiety to whatever part of the body is affected, to identify the pattern. So let's start talking about patterns. And this is in all the Chinese books, this pattern. It's a rather strange pattern, but we do see it. Heart and gallbladder qi deficiency. We don't often talk about the gallbladder qi deficiency. And the gallbladder qi gives the person a kind of, difficult to explain, like the capacity of making decisions, but also the motivation as well. So in this pattern, the person, more than anxious, will be depressed. The heart is deficient, the gallbladder is deficient, and they would find it difficult to make decisions. And by the way, I find this in practice, it really does work. You treat the gallbladder and they make a decision. It's very interesting. So I would say this causes more depression and anxiety, but it could also be anxiety. If there is anxiety, this will be very mild, very mild. Notice also easily discouraged. There's a spelling mistake there, and discouraged. Timidity as well is another symptom of this pattern. Also insomnia, waking up early in the morning, which in Western medicine is a sign of depression, by the way. And the tongue will be pale and the pulse weak. Not that common, but we do see it. And there are various prescriptions for this. This is one of them. And in the three treasures, the remedy for this pattern, heart and gallbladder qi deficiency, is soothe the shen, which is a variation of gan mei ta cao tang. There's a question here, is it qi or blood deficiency? Qi deficiency. In answer to that question, it's qi deficiency. And here you have the suggested acupuncture points. By the way, I want to stress, in all the patterns that we're going to discuss now, these acupuncture points are not prescriptions. They're not point prescriptions. You don't have to use all those points. They're point suggestions, okay? They're not point prescriptions. And by the way, the point that treats gallbladder qi deficiency, the main one, is gallbladder 40. Remember the chapter of the Neijing that talks about the Zhangfu, comparing them to ministers, and the gallbladder is the minister of justice on whom the decision making of the other 11 organs depends on the gallbladder. So it has an effect on all the organs. And this is the Chinese prescription, but I prefer gan mei ta cao tang. Next pattern is heart blood deficiency, extremely common. Much more in women, because women get much more blood deficiency than men. And this would also be a mild anxiety. So the blood is deficient, so the shen suffers from the blood deficiency and becomes a little bit agitated, anxious. This is mild, and this is also what happens sometimes, might happen after childbirth, if there is a heavy loss of blood. By the way, another heavy loss of blood in women is when they have menorrhagia or metrorrhagia, when they bleed, the periods are very heavy for year after year. That leads to blood deficiency too. And notice the classic symptoms of blood deficiency affecting the shen, with poor memory and dizziness, pale face and tiredness. This can, by the way, this can also cause depression. It can work both ways. And that's an example of a pale tongue. And the famous prescription for blood deficiency affecting the Shen is weepy tongue, which I use a lot. It's a wonderful prescription. Weepy tongue, and I have it in the three treasures. It's called Calm the Shen. Calm the Shen is a variation of weepy tongue. By the way, all these remedies they're not like Western medicine. If you take something to calm the Shen, you have to take it in the evening. You know, if you take Ambien to sleep, you have to take it in the evening. These you can take them throughout the day as well. They don't work like Western drugs. And this pattern here is also common, and it's much worse than the previous two. Why is it worse? For two reasons. One, there is yin deficiency. Yin deficiency is worse than blood deficiency. And two, there is empty heat. And empty heat agitates the Shen. By the way, do not get confused with empty heat. And some people think that empty heat is not real heat. It's false heat. Empty heat is not false heat. Empty heat causes heat as much as full heat. It derives from yin deficiency, but it is heat. So it agitates the Shen. How do we know there is yin deficiency? The tongue has no coating. That's a very important thing. If the tongue has a coating, there is no yin deficiency. In yin deficiency, the tongue has no coating. In this case here, the tongue has no coating, and it's also very red. So in this case, there is yin deficiency and severe empty heat, which agitates the Shen. You can have a tongue without coating of a normal color. So yin deficiency leads to empty heat, but you can have yin deficiency for a long time without empty heat. How do you know it? The tongue has no coating, but is of a normal color. This tongue here is very red. So this patient has yin deficiency that probably is added for many, many years, and a lot of empty heat because the tongue is very red. This is a very, very bad type of tongue, very severe condition. Very severe, so you would have to know that. It will take a long time to treat. It will be difficult to treat. And you must nourish yin and clear empty heat. And that's why there are some symptoms of yin deficiency and empty heat, such as night sweating. The feeling of it will be more in the evening. And the anxiety here is much worse than blood deficiency. When acupuncture managed to treat a Shen disturbances, will the tongue change over time? Yes, very much so. Very much so. And you do expect it to change. And actually the tongue doesn't take that long. This tongue will take a fairly long time. What would you expect to happen in this case? First of all, it should be less red. And secondly, the yin should come back. And that takes months. And you can see it very clearly on the tongue. Is like when you sow grass seeds and the first little grass seedlings come up. It's exactly the same on the tongue. You'll see the coating come back like grass. But it will take, for the coating to come back, it would take, I would say, probably 6 months. See, but the tongue diagnosis is very important in anxiety. This tongue is very bad. If you have a patient with anxiety with this tongue, it will take a long time and it will be more difficult to treat. And they would have to make changes in their life. If they are overworking or smoking, by the way, smoking also causes heat. Especially, I would say, overwork, which causes yin deficiency. And there is a famous prescription for this, Tian Wang Pu Xindan, Heavenly Emperor Tonifying the Heart Pill. Very famous formula, which is exactly for this pattern and this type of tongue. You see that Sometimes the tongue picture is very closely related to the prescription. If I see the tongue, the patient has anxiety, then you don't have to ask any other questions, almost. It's Tian Wang Pu Xin Dan. And in the three treasures, which is actually in the women's treasures, Tian Wang Pu Xin Dan is Heavenly Empress. This is in the women's treasures, but you can use it in men too, because it is a variation of Tian Wang Pu Xin Dan. Okay, so do not think that because it's in the women's treasures, men can't use it. They can. Kidney and heart yin deficiency, 6 months. How many treatments a week? Only one, I would say. I would say one a week, but with herbal treatment. Because herbs are better nourishing yin than acupuncture. Acupuncture is great too, of course, but I would say acupuncture with this prescription, the Tian Wang Pu Xin Dan prescription. How long do you prescribe Tian Wang Pu Xin Dan for? For as long as necessary. There is no contraindication in taking it a long time, 6 months, 1 year, 2 years. Okay, no problem. Oh, there is one problem I do want to mention. It's not here. If you buy some Chinese patent remedies of Tian Wang Pu Xin Dan and they're kind of red, don't use them, because they've got Zhu Sha. I don't have Zhu Sha in here. And Zhu Sha is mercury sulfate, so don't use them because they have mercury. Besides being toxic, it's illegal. So I would not recommend buying Chinese patent remedies of Tian Wang Pu Xin Dan if they look reddish outside. It means they've got Zhu Sha. Okay. And there are 3 lung patterns which I've added myself. You will not find these lung patterns in Chinese books on anxiety. And this is qi deficiency, so this will be the mildest form of anxiety, associated with some heart and lung symptoms. The lung symptoms will be the propensity to catching colds, tendency to crying. For me, is a very important lung symptom, tendency to weeping, crying, sadness, a weak voice. These are all lung symptoms. And that's a good example of a pale tongue too. But the anxiety will be rather mild. There are various formulas for this. One is called the Yangxing Tang. I got number 1 here because there are 2 Yangxing Tang in Chinese prescriptions. There's also Bufei Tang, and the remedy you can use is Prosperous Earth, which tonifies qi of spleen and lungs primarily. What if the herbal treatment is not available? Will acupuncture be effective? Yes, but it takes longer. Yes, but it will take longer, especially for yin deficiency. So the second lung pattern is qi stagnation. So the first was qi deficiency. The second is qi stagnation. A very important thing to clarify here. Notice, look at the name of this pattern, lung and heart qi stagnation. Isn't qi stagnation always related to the liver? Most people think so, and it is not true. It's not so. Practically every organ can get qi stagnation, and it doesn't have to happen through the liver. This happens very much in emotional problems, lung and heart qi stagnation. It's very common. So the qi stagnation affecting heart and lungs, and it's not necessarily through the liver. I personally feel that liver qi stagnation is overemphasized. And what type of emotions? Sadness, grief, and worry. These three emotions, in my opinion, are major emotions in the patients we see, more than anger, leading to liver Qi stagnation, in my opinion, in my experience. Grief from separation, from loss and separation. Worry. Who doesn't have worry in our type of society, with all the pressures we have? And sadness, also from loss and separation, affecting lungs and heart. And many of the symptoms will be in the chest. Chest and upper epigastric distension. The feeling of lump in the throat, by the way, is not always liver Qi stagnation. Can come from this. And distension or oppression of the chest. Slight shortness of breath. It happens a lot. And in this tongue here, there is a very slight purple color. I don't know if you can see it. Unfortunately, this arrow here is not working. As I said, there is an arrow here, but there is a bug. It's just, I can't move it. But if you notice in this tongue, it's very slightly purple towards the tip, below the center, going towards the tip. That would be the lung area, chest area. And that would indicate Qi and blood stagnation in the chest area. Very common pattern. And those are the points. Notice there's pericardium 6 for the chest with REN 17. And notice pericardium 6 and stomach 40 together with lung 7, these 3 points. Stomach 40 is not there to resolve phlegm. Stomach 40 is there in combination with pericardium 6 and lung 7. Great points for the chest. Physical level and mental level. And because I personally think that this pattern is so common, I have a remedy for it called Open the Heart, which is a variation of Ban Xia Hou Po Tang. Okay, as I said, unfortunately I can't answer all the questions because otherwise we wouldn't do anything else. Other questions are kind of not a bit off the subject of the topic, so I can't answer them. But I do encourage you to look at the blog. I think many of your questions are actually answered in the blog. And all my websites are listed at the end. So there's 3 lung patterns: Qi deficiency, Qi stagnation, and Yin deficiency. So this is more severe. The anxiety will be more severe. Why? Because there is Yin deficiency. The Yin is not rooting the lungs and heart, as we've seen the statements of that doctor. So there are some Yin deficiency symptoms such as dry mouth and throat, dry cough, the person may be thin, tickly throat, etc., etc. Weak and hoarse voice, etc. So there's lung and heart Yin deficiency. That tongue is a very good example of it, because there is some coating towards the back, but there is no coating in the front third, which is chest and lung area. And it's also red. So this person has not only Yin deficiency, but also anti-heat. So the anxiety will be more severe. And the treatment will take longer than the other 2 patterns. And you can use jade spring, which is a yin tonic for lungs, stomach, and heart. By the way, the name spring there is not spring as in the season, but spring as in the source of water, a spring of water. I call that because it nourishes yin. Heart blood stasis is not that common as a cause of anxieties, but nevertheless you do see it, and that's a very good example of a purple tongue. That tongue is very purple. And with heart blood stasis, the anxiety will be severe as well. And there will be chest symptoms as well, which you can see there with chest pain. You would see this only in middle-aged and elderly people. You would not see this in a young person. And the prescription for it is a variation of this one, Shui Fu Ju Yu Tang, which is red stirring in the Three Treasures. Phlegm heat harassing the heart. That's also a severe pattern. We've already seen that picture there. Is a classic example of phlegm heat misting the heart. Why? Because there's a sticky yellow dry coating inside the crack, inside the heart crack. And from this we can tell that the Shen is not only unsettled, but also obstructed. This will take a long time to treat. It's more severe. And this could be, for example, panic attacks, because the Shen is obstructed as well as being unsettled. By the way, most of the patterns we are seeing can cause anxiety as well, and the herbal prescription will be the same. So there are many, many similarities between anxiety and insomnia. I would say any of the patterns we've seen can also cause insomnia, and the herbal prescription will be the same. So when we discuss insomnia later, we will not spend too long looking at patterns and prescriptions because it will be the same. But there are some specific acupuncture treatments for insomnia that are interesting. And the prescription for this is the famous Wendan Tang from Sun Miao, which is a great formula. And because I like that formula so much, I made a variation of it, which is Clear the Soul. Clear the Soul is a variation of Wendan Tang and will work more on the lungs. Settling the Soul will work more on the liver. So they are both for phlegm heat. They are both for anxiety, but one treats more the lungs and heart. The other, Settling the Soul, more the liver and heart. And how we know it is the liver? The tongue could have red sides, and there'd be other symptoms more related to the liver, such as pain on the sides of the body. And this is a summary of the three treasures remedy for anxiety. We're not going to look at the case histories. You can read them in your handout. So let's look at insomnia now. Before looking at insomnia, I would like to say something about the Hun. Why? Because in insomnia, obviously, is the disharmony of the Shen. The heart houses the Shen, and at night time, the Shen must be calm, must be rooted in the heart. So you sleep well. If the Shen is calm, is rooted in the heart, if the heart has enough blood to root the Shen, you sleep well. If you don't sleep well, by definition, it is a Shen pathology. By definition, the Shen is wandering, is agitated, and you can't sleep. In order to sleep, the Shen must be rooted in heart blood. So absolutely, by definition, insomnia is a Shen pathology. And notice that the Shen can be agitated for two reasons, though. It can be agitated because the blood and yin are deficient and they don't hold it in the heart. Or it can be agitated because there is heart heat. So from a deficiency or a fullness. But the Hun also plays a role in sleep. Discussion of the Hun now would take a very long time. I have a lecture on the Hun that, I could talk about 2 or 3 hours on the Hun. The Hun I call it the ethereal soul, and it resides in the liver. The Chinese character for the Hun, if you see that on the left, contains the radical for Gui, is the spirit of a dead person. In ancient Chinese beliefs, at death you don't quite die completely because the Hun survives the body. It doesn't go to paradise or to hell or purgatory. There's nothing like that. It just survives the body. And it's also nothing to do with the Buddhist concept of reincarnation. There's no concept of reincarnation. The Hun survives the body, and that's why in Chinese tombs, especially rich people, used to put a lot of objects in the tombs that they would need in afterlife. Rich women would have cosmetic sets put in the tomb, or little figurines of servants to serve them in the afterlife, dinner sets. And this is a whole industry there was in ancient China. These objects that were put in tombs were actually called Ming Qi. And, it's quite horrific, in times before the Warring States period, they didn't put figurines of the servants in the tomb. They actually put the actual servants, the actual people were sacrificed to put in the tombs with their masters to serve them in the afterlife, because the Hun survives. It was only later on, after the Warring States period, that they stopped that custom, and instead of putting the real people, they put figurines. And that's why the emperor of the Qin dynasty had the famous terracotta army built. That was to protect him in the afterlife. Does the Hun need the father to be with the baby in order to enter? No. If you see on this slide here, there's a picture of a father with a baby, because in theory, and I'm going to ancient Chinese views, the Po comes from the mother, and the Po is present from conception, by the way. The Hun, in theory, is imparted by the father 3 days after birth. We don't have to take that literally. Everybody has a Hun, even a single mother baby has a Hun. So we don't have to take that literally. It's only because the Hun is yang and the Po is yin, so the Hun is read to the father and the Po to the mother. These are ancient Chinese beliefs. We do not have to take them literally. But in relation to sleep, sleep depends also on the Hun being rooted in the liver. The heart needs to be, the Shen needs to be rooted in the heart. The Hun needs to be rooted in the liver. And it's the same as the heart pathology. The Hun may be not rooted because there is a blood and yin deficiency, or because there is liver heat. It could be 2 reasons. And what does the Hun cause? Primarily a disturbance with dreaming. So if you have insomnia with a lot of dreams, that would indicate that the Shen is always involved, but it would indicate that the Hun is also involved. And therefore you need to root the Hun and treat the liver. And notice what that Dr. Tang Zhong Hai says. At night, during sleep, the Hun returns to the liver. If the Hun is not peaceful, there are a lot of dreams. So we do need both the Shen and the Hun. And the Golden Friar, the treatise of the Golden Friar, has a lovely sentence here. In the daytime, the Hun is in the eyes, and at night in the liver. When it is in the eyes, we can see. When it is in the liver, we dream. It's a lovely sentence. I love that sentence. They are both kind of seeing. In the daytime, you see, and in the nighttime, you also see, but you see your dreams. This slide here summarizes the pathology. Why is the Hun restless? Either because it's agitated by heat, or because liver blood and liver yin are deficient and they don't hold it, they don't anchor it, they don't root it. One is deficient, the green one is a deficient condition, the red one is a full condition. The result is the same, that the Hun wanders at night and you dream. And it's interesting that in order to subdue the Hun or make the Hun go down, to push the Hun back into the liver, use substances that are kind of astringent. So on a physical level, astringent herbs keep the fluids in. So on a psychic level, they keep the Hun in. And that's Mu Li, Lung Che, Bai Shao, Swenzo Ren, all those substances keep the Hun in, and they're all astringent. So this is a definition of insomnia. As you can see, there are many different problems. Difficulty in falling asleep, or you fall asleep and you wake up, or both. Restless sleep, waking up in the morning, early morning, dream disturbed sleep. All these would fall under the heading of insomnia, which depends, by definition, you treat the Shen, on the Shen, by definition. Of course, any other organ can also affect insomnia. The stomach heat, kidney deficiency, every organ can affect sleep. But the heart, of course, and the Shen is always involved. Notice what this doctor says. For example, this doctor here is stressed. This is the Su Wen, by the way, is stressing the kidneys. When a person lies down and cannot sleep, it means the yin organs are injured, so that the jing has no residence. So this very much attributing insomnia to a kidney deficiency, which does happen a lot, especially in older people. And notice what Jiang Jingye says: worry and excessive thinking injure the spleen, so they cannot make blood and insomnia results. So practically every tongue organ can, and the stomach too, can cause insomnia. As you might have noticed, in many of these quotations, they talk about excessive dreaming, but they don't, and they never define it. What does it mean, excessive dreaming? Some modern books have a definition of excessive dreaming. I have my own definition, and my definition is there in the yellow box. Nightmares are an example of excessive dreaming. Certainly that. If you have nightmares, it is excessive dreaming, and it's a Hun pathology. Dreams of anxiety, or dreaming that in a way that you are exhausted in the morning from dreaming. I would call all those excessive dreaming and examples of Hun pathology. Interesting thing in Chinese books, they are obsessed by nocturnal emissions in men, but I put a woman too here because it affects both men and women. And they describe this book here. This is a modern book, by the way, it's from 2005. That's how they describe excessive dreaming. Dreams of fear and anxiety, which I agree with, frequent sexual dreams, and nocturnal emissions with dreams in men. And I would not agree with that. It would be interesting to explore why Chinese books are obsessed with excessive dreaming. By the way, I can tell you very quickly that excessive dreaming causing nocturnal emissions in men is because of very ancient Chinese beliefs that if a man has nocturnal emissions with sexual dreams, he's having intercourse with gui at night, with female spirits that rob him of his jing. It's a very ancient Chinese belief, but interestingly, they're still in modern books. And I would not agree that sexual dreams are excessive dreaming, in fact. And there is a long list of dreams, by the way, which is interesting, in the Su Wen and Ling Shu. I'm not going to discuss it because they're very long. You can read about them. They're quite interesting. For example, dreaming of mountains, fire, and smoke indicates heart deficiency. Fragrant mushrooms, liver deficiency, etc., etc. These are all from the Neijing, from the Su Wen and Ling Shu. And as you can see, there's a long list. And this diagram summarizes the pathology of insomnia, as you can see, affecting Jing, Qi, and Shen. And the kidney deficiency is a very common cause of insomnia in the patients we see. When you talk about insomnia, you must exclude these things, because insomnia, obviously, if a patient has a lot of coffee, obviously they can't sleep. Or if they have a specific problem, a heavy financial problem, they are losing their house, and there's very much worrying, that's obviously a temporary cause of insomnia. So we must exclude those causes of insomnia, and also exclude other things, asthma, itching from a skin disease, or a pain. So if the person can't sleep because of these reasons, that's not what we call insomnia. But all those dreams have to do with the cultural background, right? Yes, definitely. Definitely. A Western patient would not dream of, I don't know, usually fragrant mushrooms or things like that. Yes, these are ancient description of dreams from the Neijing. We do see them occasionally. For example, crying and weeping is very much related to the lungs. So yes, I've just put them here for your own interest, but they are related to the cultural background. So etiology and pathology, basically the same as anxiety. All emotions can lead to insomnia. All of them. Worry affects the lungs, pensiveness affects the spleen. Of course, anger, sadness and grief. And I've added other emotions which are not in Chinese books, especially guilt, which I believe is a major emotion in Western patients. And it's not in Chinese books at all, and it's interesting that it's actually not in Chinese philosophy. The three major philosophies of China, Taoism, Buddhism, and Confucianism, never talk about guilt or sin, by the way. That word doesn't even exist, sin and guilt. It's interesting when I lecture on, when I have a lecture on mental emotional problems and I talk about the emotions and I talk about guilt, and I say, in my opinion, Chinese philosophies don't talk about guilt because it doesn't even exist in China. And if there are Chinese students in the class, they all say, oh, no, we do have guilt, there is guilt. There is guilt. I suspect that what they call guilt is actually shame. And shame and guilt are not the same. We can't have a long discussion about that now, but it's a very interesting discussion. And I think in Chinese society they do have shame, but not guilt as we have in the West. And I believe that guilt is very much related to the Judeo-Christian religions, the Jewish religion and the Christian religion. In the Christian religion, we even have the original sin. I mean, you're born with the original sin. How heavy can it get? Guilt, it is a common emotion, and it causes, in my opinion, a stagnation of qi and blood often. And it affects many organs, liver, lungs, of course the heart as well. Overwork, I keep mentioning overwork because in my opinion it's a major cause of disease in the patients we see, and I've already described overwork before, and it affects the yin. It causes kidney yin deficiency. Would night fright in children also have to do with kidney deficiency and heart deficiency? No. It's very different. No, the children pathology is very different than this. Children's sleep disturbances, no, they are different than what we're discussing here. And very briefly, night fright in children is often related to stomach heat. Many of the children's sleep disturbances are related to the stomach. And Dr. Shen, one of my teachers, also related night frights in children to prenatal shock, a shock to the mother. So no, that's a good question. The pathology of sleep in little babies especially is not really to do with this. So, very simply, the pathology of insomnia boils down to two things. Either there is a deficiency, blood or yin, or pathogenic factors, especially heat, but it could be phlegm as well and blood stasis, agitating the Shen and possibly the Hun. And this diagram here, which is actually from my book, summarizes the emotional causes, the pathology, and the pattern, and distinguish upon the full types on the right and the empty types on the left. Now, I want to say something about Wei Qi and sleep, and also the Yin Qi and the Yang Qi and sleep, because it's an interesting, opens up interesting avenues for the acupuncture treatment. The Wei Qi circulates 50 times in 24 hours, 25 times in the day, and 25 times at night. All this is in the Neijing. And let's see if there is a diagram. Yeah. So at night is in the yin, is in the blue, 25 times circulates. In the daytime, the red also circulates 25 times. So at night is in the yin organs. In the daytime is in the Taiyang, Shaoyang, Yangming. And that's why you fall asleep, because the Wei Qi goes into the yin in order for you to fall asleep. If for whatever reason the Wei Qi doesn't go into the yin, you can't sleep. Whatever the pattern, this is an interesting acupuncture view of sleep and insomnia. Not to do with patterns, heart heat or liver blood deficiency, liver yin deficiency. It's an interesting, purely acupuncture perspective. You don't fall asleep because the Wei Qi is in the eyes and it doesn't go in. They say the bladder one, it should go into the yin organs, and it doesn't for whatever reason. And your eyes stay open and you don't fall asleep. And at nighttime, it circulates according to the Kerr cycle, like that. From water, for kidneys, to heart, lungs, liver, and spleen, 25 times. That's the Wei Qi. Notice what Ling Shu says. when one wakes up in the morning, Wei Qi is at the corner of the eyes in bladder 1, in the Taiyang. Bladder is Taiyang. And then in the daytime, it was from Taiyang to Shaoyang, Yangming, 25 times. And during the night, it goes through the yin organs, as you can see there in the Ke cycle. Kidneys, heart, lungs, liver, and spleen, and then kidneys again, 25 times. The Su Wen says something interesting. When the patient cannot lie down quietly and the breathing is noisy, i.e. they are snoring, is due to the rebellious qi of the stomach. The 3 yang of the leg go downwards. If the flow is reversed, it causes noisy breathing. So in other words, this relates not sleeping and snoring to the stomach. And notice what it says: when the stomach is restless, sleep is restless. Another chapter of Ling Shu clarifies, says, the Wei Qi cannot enter the yin when there are pathogenic factors. See? So as I said, this Wei Qi pathology can happen with any pattern. It could be blood deficiency, yin deficiency, or it could be pathogenic factors. And notice it talks about the yang chao. This causes the yang chao to become full, and the eyes cannot close. We'll see some drawings in a moment which clarify this. So when Wei Qi is in the yin, we fall asleep. When it goes to the yang, you wake up. And when it goes to the yang, it goes from bladder 1, which is Tao Yang. And the yang chao, yang and yin chao control the opening and closing of the eyes. When the yang chao is full, the eyes stay open and you can't fall asleep. When the yin chao is full, the eyes close and you do fall asleep, but when the yin chao is overfull, it can also cause somnolence, the opposite of insomnia. So when the yang chao is full, your eyes stay open and you can't fall asleep. When the yin chao is full, you can fall asleep, which is good, but you can also have somnolence. You're sleepy during the day because there's not enough yang in the yang chao and the yin chao is over full. And it keeps your eyes want to close all the time. And we use bladder 62, kidney 6, and bladder 1. So if the eyes stay open, you want to tonify the yin chao with kidney 6. Reduce the yang chao with bladder 62 and put bladder 1, because yang chao and yin chao meet in bladder 1. If the opposite, you're always sleepy, you want to tonify the yang chao, reduce the yin chao. So tonify the yang chao with bladder 62, reduce the yin chao with kidney 6, with bladder 1 in the middle. We put bladder 1 because the yang chao and yin chao meet there. So you regulate yin and yang in the yin and the yang chao. And it must be bladder 1. I often hear, and if you don't want to do bladder 1, you can replace it with bladder 2. You can't, especially with this treatment, because the yin chao and the yang chao meet at bladder 1. They don't meet at bladder 2. And there is no problem. You shouldn't be afraid of doing bladder 1. It doesn't have to be done 1 inch deep as they do in China. It can be only 2 fen deep, just under the skin. There's no problem at all. Very superficial. It still works if it's very superficial, and reestablishes the communication between yin chao and yang chao. I don't want to go into this. We don't have time to do this. This is a description of the yin chao and yang chao pathways. It's probably easier if we look at the diagram. But notice that all these passages from various chapters, they all say the same thing. If yang qi is excessive, the eyes cannot close. You have insomnia. If yin qi is excessive, the eyes cannot open. You can't wake up in the morning and you're sleepy during the day. And that's due to the yin and the yang chao. Because the yin and the yang chao pathology is excess of yang and excess of yin respectively. And let's look at the diagram. Okay, this diagram here. So this, both the yang chao and the yin chao flow upwards to the eyes. You see these arrows flow to the eyes. Yang chao brings yang, yin chao brings yin. And yang chao should go there in the daytime, and yin chao should go there at nighttime. You notice here on the right side, the bladder channel goes down. So the yin chao and the yang chao are kind of offshoots of the bladder and the kidney channel. But notice how the yang chao is going up and the bladder channel is going down. And that's good to regulate yin and yang. You don't want to have deficient yang in the eyes, and you don't want to have deficient deficient yang in the eyes, and you don't want to have excessive yang in the eyes. So there's a regulatory system between the yang chao, yin chao, and the bladder channel. Notice what another chapter says the same thing. Notice how many chapters talk about the same thing. When a person cannot sleep is due to the wei qi staying in the yang and not entering the yin. The yang chao is full, the yin chao is empty, and the eyes cannot close. Vice versa, when the person's eyes cannot open, it is due to the wei qi staying in the yin and not entering the yang. The yin chao is full, the yang chao is empty, and the eyes cannot open. And you regulate this with bladder 62, kidney 6, and bladder 1, irrespective of the pattern. You can do that for any type of insomnia, and it works. For insomnia, you have to tonify the yin with kidney 6, you reduce the yang chao with bladder 62 and bladder 1. And you can do that in addition to other points for heart heat or liver heat or heart blood deficiency, whatever. So it's an interesting acupuncture treatment of insomnia, and also its opposite, somnolence. And notice how the Shenzhen says more or less the same thing as the Ling Shu. And that's what I do. Bladder 62 reduced, kidney 6 tonified, plus bladder 1. And I repeat, you cannot do bladder 2 because the yin chao and the yang chao meet at bladder 1. They don't meet at bladder 2. So these are some diagnostic pointers. Difficulty in falling asleep is related more to blood deficiency. The opposite, falling asleep easily by waking up, is related more to yin deficiency. And waking up early in the morning is related to heart and gallbladder deficiency. And in Western medicine, by the way, that's a sign of depression. I'm not sure it always is, but in Western medicine it is considered to be a sign of depression. There's a question here, they use bilateral UB62 and kidney 6. No, I do it unilateral. It doesn't matter which side, one on one side and one on the other. And bladder 1 is bilateral. That's what I do. But of course, you can do bladder 62 and kidney 6 bilateral as well. By the way, in your question here, you mentioned bladder 2. No, you can't do bladder 2. It has to be bladder 1. Oh, yes, you corrected it, bladder 1, yes. These are patterns, diagnostic elements of insomnia from this modern book from 2005. And I would agree with most of these things. For example, if you look at that, irritability, anger, bitter taste, red eyes, heat in the liver, and oh, by the way, that's gallbladder, not gallbladder. You should correct that. That's gallbladder. You can also diagnose the way someone sleeps. If someone sleeps always like that, indicates a full condition of the heart, of the usually lungs and heart. If someone sleeps with the arms outstretched, often indicates heat. And in children, sleeping like that usually indicates a deficiency of the stomach. It's interesting, if a person can only sleep on one side, it's either a deficiency of that side or an excess of the other side. And you can feel that by rolling your finger on the lung pulse, medially and laterally. It's interesting, there's always an imbalance between left and right. And as we've seen earlier, snoring in Chinese books is usually attributed to phlegm in the stomach channel and rebellious qi of the stomach, as we've seen in the previous quotation. So these are the patterns. Bitter taste only in the morning and bitter taste continuous all day long makes a differentiation in diagnosis? Yes. Bitter taste only in the morning is usually related to heart fire. Bitter taste all the time is usually related to liver fire. So here you have a list of the patterns, the full patterns on the left and the empty patterns on the right. I'm not going to discuss this in detail because, as you can see, many of them, well, the same as anxiety. Liver fire is a common cause of insomnia, and because the liver is involved, the Hun is involved, so there will be some pathology of dreaming, the so-called excessive dreaming, which I've already described as nightmares, unpleasant dreams, or dreaming of fire. So that would be a classic, that would be an amazing classic symptom to have, dreaming of fire when you have liver fire. Plus the tongue, of course, will have red sides and wiry pulse. And the prescription for this is Lungdan Shegantang, which is either drain fire or better settling the soul. Drain fire and settling the soul are both variations of Lungdan Shegantang. But settling the soul will be better for insomnia and to settle the Hun. And that's a very good tongue indicating liver fire. To use these remedies, to use Lungdan Shegantang, you must have liver fire rather than liver heat. And what's the difference on the tongue? It should have a thick, dry coating. And this tongue has red sides too. So this tongue is a classic tongue, indicating liver fire. The actual formula Lungdan Shegantang has Mutong in it, which we cannot use, Mutong. In Europe, there was a big uproar about Mutong some years ago, and as a result, Mutong is illegal in all its forms, even if it's not Aristolochia. Like here we go Akebia. Akebia is very different than Aristolochia, but you still can't, in Europe, you still can't use it, just in case there is a mistaken identification. But I'm surprised that in the United States, the FDA is not that strict. I've come across Chinese patent remedies for sale here by chance, and some of them still have Mutong. In Europe, that would be unthinkable. You'll be out of business if they find that you have Mutong. You'll be out of business immediately. So obviously, my remedies do not have Mutong. And they never have had it from the beginning. Heart fire, also very common cause of insomnia. Notice the tongue also. To diagnose fire, the tongue must have a thick yellow, brown, dry coating like this one. And this one has a red tip. The previous one had red sides. This is classic liver fire. And this is classic heart fire. And you can use the same remedies to settling the soul, because settling the soul works on both the liver and the heart. I repeat, to use settling the soul, the tongue must be similar to this. Thick, dry, yellow coating or brown coating. Phlegm, heat, harassing the Shen, we've already seen that in anxiety. Relatively common as well, and that's a classic tongue indicating that. We've already seen that tongue with a sticky dry yellow coating inside a hard crack. And the prescription is Wendan tongue, and we've already seen these two remedies in anxiety. Clear the soul is variation of Wendan tongue and works more on heart and lungs. Settling the soul more on heart and liver. This is not that common. And the empty types, this is incredibly common, more in women. Deficiency of blood of heart and spleen. It could be from diet, eating too many cold foods or not eating enough protein, for example, vegetarianism. Vegetarianism is okay, but women need meat more than men. So for a woman to be a vegetarian, it is possible, but she has to be more careful to eat enough protein. And the animal foods, by the way, specifically tonify the extra meridians, especially the Ren and Chung. So it could be from that, it could be from overwork, it could be from menorrhagia or metrorrhagia, leading to loss of blood over many years, or occasionally after childbirth. Very, very common type of insomnia. And the tongue is pale and the pulse is choppy. And that's a very good example of a pale and also slightly dry tongue, which would indicate specifically blood deficiency. Because the tongue could be pale also from yang deficiency. This is quite clearly more from blood deficiency because it's also dry. And the formula is the same formula that we saw for anxiety. Weepy tongue or calm the Shen. Can you repeat the statement about meat nourishing which channels? Yes. According to Li Shizhen, animal products, meat in other words, specifically nourish the Ren Mei and the Chung Mei and the Du Mei, the three most important extra meridians, Du Mei, Ren Mei, and Chung Mei, and all three of them are very much involved in menstruation and blood. I repeat, it doesn't mean that women cannot be vegetarian, they can be, but they have to be skilled at combining foods to make sure that they have enough protein. Because many young girls, for example, I saw them very frequently, become vegetarian and they just eat salads and cheese. And they're not really think about food combinations and protein and combining carbohydrates with beans that makes a complete protein, etc., etc. The acupuncture point once a week, yes, I would say about once a week. unless you're giving the patients also herbal remedies. And if the patient is having also herbal remedies, you can reduce the frequency of acupuncture. Heart yin deficiency will be one step further than heart blood deficiency. And how do we know there is yin deficiency? The tongue lacks a coating, like this one. And this is a very good example of a tongue without coating, except coating here on the root, but not red. So if you remember the tongue we saw that was very red without coating, so yin deficiency with anti-heat, this patient has yin deficiency but not anti-heat yet. Eventually she would develop, without treatment, she would develop anti-heat as well. And the prescription for that is Yang Shin Tang number 2. As I said, there is 2 Yang Shin Tang. Heart and kidney is not harmonized is heart and kidney yin deficiency with heart anti-heat. We have seen this in anxiety exactly the same. And we've seen that tongue too. Notice the difference between this tongue and this. This tongue is without coating, but normal color. So yin deficiency without anti-heat. Eventually, without treatment, this tongue will become red. So this is yin deficiency without anti-heat, and this is yin deficiency with severe anti-heat, the lower one. The prescription, we've already seen it, is Heavenly Empress, which is a variation of Tian Wang Pu Xin Dan. And liver yin deficiency is also a common cause of insomnia. Because it's liver yin deficiency, there will be problems with dreaming, as we've seen before. By the way, in severe cases of the Hun wandering a lot at night, there could be sleepwalking. Sleepwalking is also a Hun pathology. The bladder point in the back, bladder 47 for the Hun, is called Hun Men, the door of Hun, was used for sleepwalking. So sleepwalking is also a pathology of the Hun. Interestingly, the drug Ambien, if you know the drug Ambien, is used a lot in the United States for insomnia, may cause sleepwalking. So obviously affects the Hun, so it does the opposite of what it should do. It should treat insomnia, but when it causes sleepwalking, it would be agitating the Hun. And this is a very good example of liver yin deficiency. And the prescription is a very famous prescription. Sven Zarentang is a great formula. If there's insomnia from liver yin deficiency, this is a great formula. And I have a variation of it called Nourish the Soul. There are 2 actually, Nourish the Soul and Root the Spirit, for this type of insomnia from liver yin deficiency. Is there any front point to ground the Hun? Very much so. The main one, you know which one it is for me? Ren 4. Ren 4 is an amazing point. It tonifies kidney yin, kidney yang with moxa, the yuan qi, the uterus, blood, yin, and jing. So if I wanted to tonify liver yin, let's go back to that. Let's go back to that for a moment. Notice the points I have: liver 8, spleen 6, there will be important points. Bladder 47 is the point for Hun, but notice I have Ren 4. That would be a major point for me to nourish liver yin, And rainfall, by the way, does also calms the Shen. By tonifying the root, the lower burner, it kind of makes the Shen sink, go down to its root. And so, yes, I would use rainfall all the time. And these 3 points together are used to nourish liver yin. Liver 8, rainfall, and spleen 6. And Do20 have similar effects. I don't use Do20 for insomnia. I would use Do19 or 24, not Do20. Okay, this leads us more or less to the end of the seminar. And this is just a summary of the 3 treasures remedies for insomnia. And we've seen all of those. By the way, dosage. Let's say you have an adult with insomnia from blood deficiency, you give them Calm the Shen. I would say between 4 and 6 tablets. 4 would be a low dose. 6 would be an average dose. Let's say 6 tablets, maybe 3 in the afternoon and 3 in the evening. And the same for all the other remedies. If it's a very severe case, let's say they have severe yin deficiency, you use Heavenly Empress, you could use 9 tablets. So roughly I would say between 4 would be a low dose, and 9 would be a high dose, and 6 kind of average dose. So as I was saying, this is a list of all my various websites. Because I had so many websites, which are here in the yellow box, I created a new page, which is simply called maciocia.com, which from that page you can go to all the others. So it's probably easier to go to that page first. And as you can see, there's a blog, the Maciocia Online blog spot. Some of the questions you've asked, the answer is in the blog. For example, someone asked about the points to resolve phlegm. They would be in the blog. So I do encourage you to look at it. And also, I try to write a newsletter with a clinical tip every month. I try to, which I post on the blog. And from the blog, it goes automatically to the Facebook page as well. So you can look at the Facebook page. Something has happened. Okay. And there's also 2 sites in Spanish. There's a blog in Spanish and a Facebook page in Spanish. And the site specifically related to the 3 treasures is this one, 3treasures.com. And in order to get the clinical tip emails monthly, you need to register. You can register in the first 3 websites. You can register. Okay, that leads to the end of the webinar, and you will, if you haven't got the handout, write to Monica, you will get it. And you will get also a recording of this, but give me time, because it takes time for the recording to be saved. So you get a recording of this as well. So thank you very much for attending. Last question, there's a question here about the breast area and tongue diagnosis. That's one of the clinical tips. That's definitely on the blog. So do look at the blog. A lot of the answers to your questions are there. Thank you very much, and goodbye. And thanks for attending this webinar, and look out for future ones. Thank you.